A shocking medical case has revealed the hidden dangers of parasitic infections, showing how a seemingly minor symptom can be the first sign of something far more serious. A woman who initially experienced a burning sensation in her leg was later found to have a parasitic worm living in her brain, underscoring the unpredictable and often overlooked risks of parasitic diseases. This case serves as a stark reminder that infections caused by parasites are not just a concern for specific regions or populations. They can strike unexpectedly, often going undiagnosed for long periods, leading to severe health complications. Parasitic infections are notoriously difficult to detect, as symptoms can be vague and easily mistaken for other conditions. In this case, the woman's initial complaints were dismissed as nerve-related pain, a common misdiagnosis when dealing with parasitic infestations in the nervous system. The delay in proper diagnosis highlights a major issue in medical treatment. Parasites often remain undetected until they have caused significant damage. Many of these infections can persist for years without obvious signs, allowing the parasite to slowly invade critical areas of the body, including the brain. By the time the real cause is identified, the patient may have already suffered irreversible harm. What makes this case particularly alarming is the ability of certain parasites to cross into the brain, a phenomenon known as neuroinvasion. The brain is normally protected by the blood-brain barrier, which prevents most harmful substances from entering. However, some parasites have evolved mechanisms to bypass this defense, leading to potentially life-threatening conditions such as inflammation, seizures, and cognitive decline. Once a parasite reaches the brain, treatment becomes significantly more complicated as many antiparasitic medications struggle to penetrate the protective barrier effectively. This means that by the time symptoms become severe enough to warrant neurological investigations, the damage may already be extensive. Parasitic infections like this one often originate from contaminated food, water, or contact with infected animals. In some cases, the source may be something as simple as consuming undercooked meat or accidentally ingesting microscopic parasite eggs from unwashed produce. The fact that these infections can result from such everyday activities makes them even more insidious. Global travel, climate change, and increasing human interaction with wildlife are also contributing to the spread of parasites to new regions, meaning that even those who consider themselves at low risk may still be vulnerable. This case is a warning that no one is entirely safe from the threat of parasitic infections, no matter where they live. Even when parasites do not reach the brain, they can cause long-term health issues by settling in other organs, leading to chronic pain, organ failure, or immune system disruption. Many people infected with parasites suffer from unexplained fatigue, gastrointestinal problems, or muscle pain, never realizing that the root cause of their condition is an undiagnosed infection. This raises concerns about how many cases go unnoticed and untreated, allowing parasites to silently impact public health on a much larger scale than is currently acknowledged. Despite these dangers, awareness of parasitic infections remains low, and many healthcare professionals are not trained to recognize them unless they are dealing with patients from high-risk areas. This case demonstrates the need for better diagnostic tools and increased vigilance in identifying parasitic diseases, especially when symptoms do not fit common patterns. It also underscores the importance of preventive measures, such as proper food handling, thorough cooking of meat, and hygiene practices that reduce the risk of accidental exposure. The presence of a parasite in the brain is one of the most frightening medical scenarios imaginable. And this case serves as a grim reminder that such infections are not confined to science fiction or rare medical textbooks. They are real, they're dangerous, and they are more common than most people realize. Without greater awareness and improved detection methods, many more individuals may suffer from undiagnosed parasitic infections, leading to serious, life-altering consequences. This case is not just an isolated incident. It is a warning that parasites remain a silent but significant threat to human health.